Type 2 diabetes is a condition that causes the level of glucose in the blood to become higher than normal. Type 2 diabetes is primarily the result of two interrelated problems. One, the cells in the muscle, the fat, and the liver become resistant to insulin. And because these cells don't interact in a normal way with insulin, they don't take in enough sugar. And two, the pancreas is unable to produce enough insulin to manage the blood sugar levels. There's many supplements that you can take to help if you have type 2 diabetes. One is biotin. Biotin may improve glucose and triglyceride levels in people with type 2 diabetes and also reduce pain from diabetic nerve damage. Biotin is a B vitamin and is needed to activate a major enzyme involved in glucose metabolism. Chromium, taken as chromium piclinate. It specifically has been shown to reduce insulin resistance and to help reduce the risk of cardiovascular disease and type 2 diabetes. Dietary chromium is poorly absorbed, however, and chromium levels decrease with age, so supplementation is very important. A new study from Deakin University found that taking just 500 milligrams of vitamin C twice a day can help those with type 2 diabetes by lowering elevated blood sugar levels and minimizing spikes in blood sugar after meals. The best form of vitamin C is liposomal vitamin C, then a non-acidic buffered form, with the worst form being a cheap acidic ascorbic acid. Adults with type 2 diabetes and low levels of vitamin B12 could be more likely to experience cardiovascular autonomic neuropathy. This is according to new findings. And cardiovascular autonomic neuropathy is when nerve damage affects the heart, and this can be caused by prolonged hyperglycemia, which is high blood sugar, over several years in people who have diabetes. It's important to realize that a B12 blood test may not detect a B12 deficiency, as food is now fortified with folate, and this can give a false reading in the test. Apart from B12 injections, the next best form of B12 is a sublingual methylcobalamin powder. Research has shown that berberine can help people with high cholesterol, high blood pressure, polycystic ovary syndrome, and skin issues like burns and canker sores. It's also been shown to help people with type 2 diabetes because it appears to help regulate blood sugar, just like the drug metformin, but berberine has less side effects. Typical doses are 500 milligrams 3 times per day of berberine as berberine hydrochloride. You can see my other videos, one of them on life extension and one on the anabolic triad for more potential benefits from taking berberine. The results of a study show that the intake of 1, 3, and even 6 grams of cinnamon per day all reduce serum glucose, triglycerides, LDL cholesterol, and total cholesterol in people with type 2 diabetes. And this suggests that the inclusion of cinnamon in the diet of people with type 2 diabetes will reduce risk factors and associated complications. Alpha-lipoic acid. While most of the research on alpha-lipoic acid in diabetes has focused on the effects of neuropathy, several clinical trials have now found that alpha-lipoic acid may also increase insulin sensitivity and help reduce blood sugar and lipids, largely through improving measures of oxidative stress and inflammation. Typical doses of alpha-lipoic acid are 600 milligrams, taken 2 to 3 times per day with a meal. In one study, 50 female participants with type 2 diabetes received either 1 gram of royal jelly or placebo once a day for 8 weeks. And the results indicated that taking royal jelly can lead to a reduction in the level of blood sugar. There's some evidence that taking high doses of vanadyl sulfate, 100 milligrams daily, which will provide 31 milligrams of elemental vanadium, can improve the way that people with type 2 diabetes use insulin, the hormone that processes sugar. Randomized controlled clinical trials have demonstrated that supplementation with CoQ10 can significantly improve glycemic control, as well as improve vascular dysfunction. Supplementation with CoQ10 may be of particular importance in type 2 diabetics prescribed statins and in those with fatty liver disease. Doses can be 300 to 500 milligrams per day. CoQ10 works better when taken with 40 milligrams of PQQ per day. You can see my other video on mitochondria boosters for more ways to help mitochondria function. Vitamin D supplementation may lower average blood sugar levels in people with type 2 diabetes, and it's especially effective in people who also have a vitamin D deficiency and are non-obese and deficient. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3. It's estimated that 1 in 2 people with type 2 diabetes have sleep problems due to unstable blood sugar levels and accompanying diabetes-related symptoms. High blood sugar and low blood sugar during the night can lead to insomnia and next-day fatigue. You can see my other video on herbs to help sleep for more information on possible remedies to this. People with type 2 diabetes should undertake at least 150 minutes a week of moderate to vigorous exercise. Aerobic exercise spread out during at least 3 days during the week, with no more than 2 consecutive days between bouts of aerobic activity. A gentle 20 to 30 minute walk after a meal has been shown to help reduce blood sugar spikes naturally. Overall, an intervention involving fiber supplementation for type 2 diabetes can reduce fasting blood glucose and the HbA1c. This suggests that increasing fiber in the diet of people with type 2 diabetes is beneficial, and it should be encouraged as a disease management strategy. Magnesium helps to regulate blood sugar among its many benefits, and a magnesium deficiency is often seen in people with diabetes. A deficiency can occur with type 1 and 2 diabetes, but it appears to be more prevalent with type 2. This is because low levels of magnesium are associated with insulin resistance. The best form of magnesium is magnesium bisglycinate. In order to determine your dose, slowly increase until side effects like stomach discomfort or diarrhea are noticed. Then slowly decrease the dose until you find your maximum tolerable amount. As magnesium is required for the proper functioning of hundreds of enzymes, it can have profound benefits to health when taken for a few months. Another supplement that's needed by many enzymes and may work synergistically here is zinc, usually taken in the form of zinc piclinate. Some studies have shown that zinc improves glucose levels in people with diabetes. The low glycemic diet is based on the concept of the glycemic index, and studies have shown that the low glycemic index diet can result in weight loss, reduce blood sugar levels, and lower the risk of heart disease and type 2 diabetes. Other dietary recommendations for diabetes are low lectin and gluten-free diets. Despite marketing, different studies done by reputable researchers revealed that those who drank diet sodas actually increased the risk of contracting type 2 diabetes. The odds of acquiring diabetes for diet drinkers are actually higher than those who drink regular sugary sodas. These results are found to be consistent even when measured on an equal serving basis. And what's even more bothersome is that there's a craving effect associated with these drinks. Studies have shown that those who consume products made with artificial sweeteners, such as aspartame, have a higher affinity for sugar. That is, those who are exposed to higher amounts of aspartame actually crave more sugary items, leading to binges that can further increase the risk of contracting diabetes and other health complications, such as memory impairment and early onset of dementia. And last but not least, even though aspartame doesn't contain any sugar, it had some physiological effects similar to sugar, thus increasing blood sugar levels and eventually insulin levels. It's this sudden increase in insulin production that leads to the desensitization to insulin, which is the main symptom of type 2 diabetes.